My name is Violet Larry, and I'm here with my daughter, Drechelle McCray, and we're just going to share our story a little bit around birth outcomes and the importance of having support. I am a nurse, and I currently manage the Healthy Birth Initiatives program in Portland, Oregon, in Multnomah County. And this program is an African American, culturally specific home visiting program. And our sole purpose is to decrease infant mortality, low birth weight, preterm birth, and maternal mortality and morbidity. So you would think this would be the ideal program for my daughter to be involved with. But the nurse that I am, and my mother's a nurse, and the need for her to be a part of the program wasn't evident with her first pregnancy. And so she wasn't a part of this program. I'm going to let her share a little bit about her birthing experience.
My name is Drechelle McCray, born and raised in Portland, Oregon, and I became pregnant with my first child 2014, but my pregnancy was great. I didn't have any problems until I went to a dentist appointment in March 2014. So my blood pressure was extremely high, and they were like, well, maybe you're just nervous because you're here in the dentist. And I was like, I've been to the dentist many times. I'm not nervous right now. So they took it again, and they said, because your numbers are so high, we're not going to treat you today. And they said, you need to contact your healthcare provider immediately. So I called my healthcare provider and let them know that the dentist would not see me because my blood pressure was so high. They had me come into the hospital to see what was happening, what was taking place. Of course, yes, my blood pressure was high. My normal numbers were 120 over 80, but these numbers were 100 over 100 and increasing in number. So then they hooked me up and to make sure that all my blood work was correct. And I was there for quite some time. This is my first pregnancy. So of course I'm nervous. I'm not sure what's going on. And I want to have a healthy baby because at this time I was about 34 weeks and I wanted to make it all the way to gestation, all the way to 40 weeks, if at all possible. The doctor said, you know what, we're going to keep you here for a little while longer. And then I was like, oh, okay, what's happening? What's going on? And then my numbers started to change. So they let me go home. And my mom, being a nurse, she would check my blood pressure from time to time or check any symptoms that I had, just because, of course, if I can talk to my mom, I'm going to talk to my mom. She came home after work and my numbers were still really high. And she's like, this isn't good. Are you experiencing any swelling? Is anything going on? And I continued to say no. But my doctor then had me go back to the hospital, and then they kept me because I started to develop what is called HELP syndrome, hemolysis, elevated liver enzymes, and low platelet count. And my platelet count began to drop, and your organs can start to shut down as well. And so again, I'm getting really, really nervous. My husband is working full time at work as a manager at Walgreens, so his schedule is really crazy. But my mom was able to be in the hospital. At the time, I was a teacher at Portland Adventist Academy, and the hospital that I went to was the Adventist Medical Center. And some of the nurses actually knew who I was. So I took that as a positive, but at the same time, it was still nerve-wracking because, again, I'm still a Black face in a white space. And making sure that my child is being taken care of, that my health is being taken care of, just a lot of things are going on in my brain. The doctor who had been my gynecologist for quite some time since I was in high school, he was actually the gynecologist for my mother as well. So we had the same doctor, knew some family history. With my platelet going down, he said, we need to try to get labor going. My water broke, and sometimes when you're in the hospital, when Black women say they are in pain, they're not always given adequate treatment that they should receive because they think our pain tolerance is so high. So they were asking about medications and whatnot. My blood pressure was still not the way it needed to be. I hadn't been on blood pressure medication prior to that. Then I started to develop a really severe headache. I've never had a headache to this extreme. We end up delivering and having an emergency C-section. I am 35 weeks because we wanted to keep the baby in as long as we can because one day inside is like 1 week out. We delivered the baby. My son was 4 pounds, 15 ounces, very, very tiny. He didn't have any complications. He was great. Everything was fine with him. But shortly after, they wheeled me back into my room, and my mom was in the room at this time. I started to
Started hemorrhaging.
Started hemorrhaging.
Yeah, you weren't Drechelle wasn't aware of anything that was going on, and neither was her husband, who was also in the room. And, we just were in awe of the new baby, who they also wheeled in at the same time. Me being the nurse, when other nurses started coming into the room, and I knew the language that my daughter was hemorrhaging, we almost lost her because of the severe amount of blood
2.5
that she was losing. 2.5 liters?
2.5 liters.
And I truly believe that if I was not in that room, if they hadn't known that I was a nurse, I don't think she would have received the care that she received. We aren't always cared for. I don't think she would be with us if I wasn't in that room to be a presence. I wasn't saying a word, but the nurses knew that I was a nurse and that they better have their act together.
Mm-hmm.
She has recovered well. The baby is now
8
years old. He's doing well, healthy,
Mm-hmm.
thriving. But initially, it was really scary for all of us. We hadn't had a preemie in the family, but it's scary to be a Black woman. We never would have thought Drechelle having all of the support. She had parents. She was married. They own their home. They both are educated. They both have careers, but still face this challenging moment. It brings on an additional stressor.
Yes.
Maybe you can speak to the stressors a little bit.
It is definitely a stressor because when I go into spaces, be it work, be it at the hospital, it's always in the back of my head. And what kind of care am I going to get, or what kind of comments am I going to receive? There's always thoughts in the back of my head is, am I getting the same treatment that someone who is not Black is going to be receiving at this time? Because most people are nervous their first pregnancy. You don't know what to expect. Your body is going through a lot of different things. You're feeling a lot of different ways. Leading up to it, everything was going right with my pregnancy. And I was going to have this birth plan, and we were going to follow this from this step to this step to this step. And it didn't. Then my life is starting to change. My mind is starting to change. And how, like my mom said, having a premature baby, because it's 4 pounds, 15 ounces. He was 4 pounds, 15 ounces. But in the hospital, babies lose weight. So even to drop their weight and seeing how tiny he was, it's frustrating going into spaces when there is no one who looks like you. I don't think I had one Black nurse when I was in the hospital with my son. Seeing Black doctors, that's not even something that I can even fathom here necessarily in Oregon. After hemorrhaging and then getting a blood transfusion, my blood pressure did not drop. At the highest, it was 200/100. I should not be alive based off of those numbers, solely based off of those numbers. And eventually we were able to stabilize. We stayed in the hospital for almost a week after that. Then my mom even started to have her own health complications.
Well, when the baby was born, he came early, but I lined up all of these other nurses. It's like, Drechelle, call this one, call this one, call this one. If you need any help, they're there for you. They're waiting for your call. But while I was in Washington, D.C., all of a sudden I started having severe headaches, blurred vision. We get back home and come to find out I have this tumor that's pressing on the optic nerve and needed to be removed right away if I was to have a chance of regaining my vision. So by the time I had surgery, I had lost my vision completely. And so Drechelle, who is recovering, is having to deal with all of these emotions at the same time. And I can recall her saying, I don't have this euphoria of, oh, I'm so happy to be a mom. Mm-hmm. I just am so in love with this baby. I know it has to do with all of the challenges that were placed on her around the pregnancy and then delivering a preterm baby and then having a mom who may be blind. All of that is going on, but we made it through. That was baby number one.
That was a really tough time because my mom is one of my best friends. So to think of raising my first child without my mom or my mom not being present, I wasn't able to handle that. My mom's going blind. Like, are you serious right now? Like, what? It was a long road.
Now we're pregnant again. Mm-hmm. I say we're a family. We're all in this together. And I remember asking her, do you want to be a part of HBI? And she said, okay, Mom. I'll do it, even though she still would come to me with questions and I would say, what?
Ask your nurse.
That's right. Ask your nurse. So to help change the relationship a little bit, I remember what you said about having a Black nurse. Mom, I had no idea that having a Black nurse, somebody who looks like me, would make such a difference.
Yep.
Somebody who, there's some things culturally that we don't have to explain to each other. And that helped in reducing the level of stress for this second pregnancy.
I did enroll in the program. I got a nurse, Nurse Vashita. When you're in the program, your nurse is with you during pregnancy all the way into the child is the age of 2. They visit you, and she came to my job. She would come during my lunch break or even after school, and we would just talk. We would just have conversation. It wasn't always just straight into that medical piece. And then checking in of how things were going mentally, emotionally, financially, how things were taking place in my marriage. And she always gave resources, or she would say, hey, I'll look that up for you if that's something that you need. And she always followed through, always had different programs for me to get involved in, different opportunities, and then building a community, because HBI has programs where you can meet with other mothers, some that are going through some of the exact same things that you're going through, or others that you can give advice to and have conversations and be in leadership groups and to be in teams. Through the pregnancy with my second child, things were a lot smoother. I did have to have, I will say, another emergency C-section because my baby stopped moving, and come to find out she had her umbilical cord wrapped around her neck. But healthy delivery, and neither one of my children have health complications. They didn't have to spend time in the NICU. They passed every test that they had to go through. And I know this second pregnancy, having the support of my nurse through HBI helped leaps and bounds. The same stressors I had even talking to my nurse, I didn't have to explain. I could just be.
We stepped out of our comfort zone to let somebody else in, because as Black people, we don't always do that. But we have learned through this experience that we need other people too. With Drechelle's relationship with HBI, she was able to find an African-American pediatrician.
So HBI, they have meetings once a month, Community Action Network meetings, and they bring in guest speakers, some local, to talk about different topics. And this one that I tuned into was about pediatrics. The doctor was speaking. I was like, well, are you taking any clients right now? And he said, they're going to tell you no. However, you let them know that you are Black, that you have Black children, and a way will be made. So when I call at OHSU for Dr. Antoine Chavez, they said, of course, that, he's not taking any patients right now. We'll get back to you. And I said, well, my name is Drechelle McCray. I spoke with Dr. Chavez at the Community Action Network meeting, and he said that he is taking Black patients at this time. So I gave all that information. It's good to know somebody and to be able to say those things, because you can get turned away quickly. Next day they called, oh, by the way, we have an opening. We can take new patients. And I was like, I appreciate it, because I have 2 children. And if I could have them have a Black doctor to know that there are people that look like them, that care about them with their health, it moves mountains. So we scheduled an appointment, and my husband actually took the children to the appointment, because that's sometimes a narrative that is placed within the Black communities, that Black fathers are not engaged and not involved. And with HBI, not only do they focus on the mothers, but they have a program for fathers as well to get involved, to get them active and to remain active in their children's lives. So my husband has always been there and always been a support. And one of the questions that he asked my children was, what is their hair care routine? Because I'm on FaceTime, and it caught me off guard, because all of my years, my siblings and I always had white doctors. My child, who has eczema, and when it comes to itching and scratching and things, we've never been asked about our hair care routine. That right there showed me that he saw us, because with Black hair, washing it, the maintenance, taking care of it, it's like, you see my child. You're not just asking baseline questions. You want to know what's going on with their hair care. How are they represented in the school system? He was asking, what's going on with their teachers? What are they exposed to? Is diversity there? Are they having diverse conversations about what's happening in the world, what's happening in their life? Are they the only Black children in their classrooms? He also provided resources for us to take because, again, living in the city of Portland, you're typically, when you're a Black child, you are one of few. And then having a Black teacher, that's still one of few as well. So to have that, we felt completely seen. And my husband walked away feeling even more positive. He's like, oh, you're switching doctors. What's the plan for this? But he was thoroughly impressed with the visit that we had. It's changed our lives in many ways. And then my children, especially my son, he was excited to be able to see it. Like, Mommy, my doctor looks like me.
We're just thankful and blessed that our story has a positive outcome. Because of our story, we're now advocates, in a different way. I've done this work for over 30 years, but never, like everyone else, you always think the poor birth outcomes are a result of not having a doctor, not having a place to live, or having a place to live and that not being the right place. All of those social determinants, which do lead to poor birth outcomes. For us, we didn't have any of that. And so letting our guard down enough to let somebody else enter our lives, because even if they're Black, we still have this hesitancy.
With my first child, I didn't really think having someone else was necessary. I didn't think having someone just to talk to was necessary. But it's seeing something as small as having a conversation with somebody where you don't have to explain, you can just be. It's important. And the word needs to get out there of knowing that these birth outcomes affect Black families, all walks of life. It doesn't matter the stereotypes that are given of Black people, of it's just the poor Black people that are on Section 8, that are this, that, and the other. No, I'm educated with a master's. I had a birth outcome the way that I did. And having that extra support through my second pregnancy, I know it moved mountains in a way that I'm thankful and grateful for that opportunity to be able to have HBI, a program that is thriving in Portland. And I definitely support and promote it whenever I have the opportunity.
Every day there's a situation that makes us stop and think, oh, how am I going to respond to this? Or what is this person thinking about me?
Yep.
And that, that affects us physically. So for those women who are still of childbearing age, you think of just going to the hospital. I'm pregnant, I'm ready to deliver, but that security guard looks at us in a different way. The receptionist at check-in looks at us in a different way. And then the nurses, depending on where they've come from, they're looking at us in a different way. And we have to internalize all of that. We're hopeful and know that change is happening, but change takes a long time. And so we're hoping that we as a society can get there so that we can eliminate these poor birth outcomes.
All right.
Okay. Thank you. Thank you for listening to our story.
Yes, thank you.
We talk about our story all the time.
So thank you. Thank you again for listening. Thank you for the opportunity. And hopefully you were able to gain some new information so that we can change birth outcomes here in America.